So I am Dr. Mujeeb Rahman, consultant pulmonologist at Lakeshore Hospital. Today with me we have Dr. Rithu Raj. He is coming all the way from Allahabad, Uttar Pradesh for treatment here in Lakeshore Hospital. So Dr. Rithu Raj is our patient for last 2 years. He came to me on an evening with a very severe asthma exacerbation, and he was suffering with asthma for last many years with severe form of asthma, multiple exacerbation, and he was on oral steroids and many various tablets. So we have addressed all these issues of Dr. Rithu Raj, and we given an excellent treatment for him. Welcome, Dr. Rithu Raj.
Thank you for inviting me on this talk.
So could you please tell me how was your disease of asthma started and how it has progressed over the years?
I don't remember how it started, but since my teenage, I was having 2 to 3 episodes every year of severe exacerbations, and I was generally treated with oral medications.
Okay.
Later on, in my later life, I consulted many pulmonologists, almost all over India.
Okay.
And sometimes they gave me inhaler, sometimes OCS oral steroids, and sometimes these bronchodilator tablets.
Okay.
But in all the cases, no one told me that you have to continue your inhaler
for a certain period of time.
And so
so over the years your symptom become more and more severe. Do you felt like that?
Yes, I developed COVID in 2021, severe COVID, and then again in 2022, almost I was told in Fortis I was admitted in ICU for more than 15 days, and there I was told that my lungs almost collapsed. So I was on oral tablets of steroids, then IV injections of steroid. At that point of time, I was feeling very much depressed that my life has gone. I'm not able to do anything. I'm still 47, and I have one kid, or you can say he's teenager in class 12. So I was very much depressed that how my family would manage, how
about the future.
Then luckily I was sitting in a restaurant when I developed severe dyspnea, and I searched on the internet.
Okay.
As a tourist, I came over here with my severe asthma problem because all the dates were fixed, and I don't want to spoil the planning of my family. So I came with hiding all my problems, and I came over here. But when I was not able to bear at the restaurant, I searched on the net, and at that time, luckily I found your details. And then I called you, and rest is history. I am here with you.
Okay. So Dr. Rithu Raj came to me on an evening, and we had a detailed evaluation at that time, and he required initial couple of days admission because of severe asthma. And on further our evaluation, we found that he is suffering with a severe allergic asthma, and we did extensive workout of allergy and asthma of Dr. Rithu Raj, and we given specific inhaler which is ultra long acting with a triple drug combination. We also started him on specific allergy medication called omalizumab, which is a monthly injection, which he's on this medication for the last 1 year, and he had a dramatic improvement in overall condition. So we'll ask Dr. Rithu Raj, how was the improvement after doing all this specific therapy of severe asthma?
I can say that after taking your medications like new inhaler and the omalizumab injection for at least 3-4 months, I was completely normal.
Correct.
and there wasn't any episode of severe asthma attack in last 2 years. Though when I by mistake or by you can say I have stopped some medication for few days, I developed some symptoms again. Then I contacted you and you scolded me that no, you don't have to stop.
So, correct. So he is giving an excellent example that we should not rely completely on oral treatment. We should not take too much steroid orally to control the asthma, and we should take a proper the asthma medication. Like inhaler is the safest medication for that, and in certain cases we may also require severe asthma medication like injection like omalizumab, mepolizumab, benrolizumab, which is available in India and across the world. So now we will ask Dr. Rithu Raj, what is your point of view? What are the side effects you developed as a part of this much steroid which you took in multiple courses?
I personally feel that all the side effects were because of oral steroids.
Oral tablet, yes.
Yes. And I would like to point out that my mistake or the physician's mistake was that I was given more of oral tablets rather than inhaler in my early days of my disease.
Correct.
So I suffered a lot, and because of oral steroids I have developed one severe problem, that is glaucoma.
Correct.
And obesity. My
joint muscle
bones, yes, bones are weak. So I have to take some medications for that. But anyway, I'm normal now.
So with God's grace and with our dedicated treatment, he is doing great now. He's on our follow-up and he is coming all the way from Allahabad. This is the 6th visit to Lakeshore. What are your message to the public there are a lot of asthma patients in our public. What are your message to these patients with asthma? What they should do and what they should not do in their lives?
As I am chronic patient, so I may know something much more than the normal public.
Correct.
So I would like to suggest that please don't ignore your minimal symptoms of asthma.
Correct.
And consult your pulmonologist. And whenever he has advised the inhaler, you should take it and continue to take it till he has advised you to stop.
Correct. Excellent.
This is most important part, otherwise you would suffer. Always use inhaler with spacers.
Correct.
That is most important thing, otherwise your medicine would be wasted. Other thing I would like to suggest, that is not the part, but I am coming all the way, spending around 2 lakh per visit just to consult Dr. Mujeeb in person. Now you can, sir, you can just feel that what level of, you are one of the best pulmonologists I have ever met.
Thank you.
That's why I am coming all the way, and thanks to you and thanks to Lakeshore Hospital.
Lakeshore, yeah.
And one thing I would like to tell you that right now my mother, who is 77, she is also started taking the treatment at Lakeshore, and she is saying that my treatment would continue only in Lakeshore.
Okay. So with this we'll conclude this video. The main message is that we should take inhaler, which is having very less side effect based on the treatment, and we should restrict our use of oral steroid, oral tablets for asthma. And if you have a pulmonologist nearby, you should consult the pulmonologist and take their opinion, take their advice, follow up them with regularly, and always to be adherent to their advices and follow-ups. Thank you.